Hello and good afternoon. We're just going to give it a few moments so people can get logged in. Okay, so thank you for joining our webinar today. I'm Bethany Mifsud, an account manager with Connie. On our call today, we also have Erin Tyrrell, who is Connie's clinical application trainer. We also have Caitlin Kilcrease, who is Connie's outreach and integration coordinator. We have Melissa Schuster, who is Connie's program assistant. And we have Amanda Crociata, who is our Director of Account Management. So thank you for joining us today. We will be recording today's webinar so that we can share it with those who could not make it. If you do have any questions, feel free to pick our brains as we have a great team here. And you can do that by putting your questions in the Q&A because we can easily monitor it there. And also, if you'd like to speak, just raise your hand and we can unmute you. Okay, so our agenda for today is as follows. We want to give you just a brief update on Connie, show you our Population Explorer tool and all of the benefits, and then open it up for any questions. Okay, so Connie is live and there is already a ton of valuable healthcare data being securely shared between participating organizations. We are currently connected to all of the major hospital and health systems across the state, including 3,000 healthcare locations. Erin will show you where to find this on our website shortly. This list is updated weekly. So for example, we can see that Anthology of Farmington is sharing a panel, an ADT or admit discharge transfer data feed, and CCD or continuity of care document. And these are examples of different data feeds. And you'll see we're also receiving labs, radiology reports, transcription notes, and even images. So I think everyone on this call knows that a health information exchange allows healthcare professionals to appropriately access and securely share a patient's medical information electronically. So we are happy to report some of our recent integrations. We have successfully migrated Trinity Health of New England, are integrated with their Community Connect practices, and are currently working on setting up our InContext app with them. Hartford Healthcare and Griffin Hospital have gone live with images, and CVS Omnicare and Minute Clinics are now live as well, with additional pharmacies in our queue. So today we're going to focus on our Connie alerts that are available through our Population Explorer tool. This can be provisioned by your organization's HIE administrator. If you have any questions on who that is for your organization or the process, please feel free to reach out to your account manager. Our Population Explorer makes it simple to track and follow up with patients and their providers to work collaboratively when inpatient, outpatient, and/or emergency care encounters occur. This work list includes your entire patient roster, notifications from all of the hospital systems, has no user limits, advanced custom filter options, and is exportable to an Excel file or PDF file. As the most widely used tool, this feature allows providers to retrieve a patient's comprehensive encounter history from both inpatient and outpatient settings. This tool is instrumental for care coordination and notifying providers of recent patient encounters at different facilities. This capability is especially valuable in emergencies, enabling timely support and follow-up care across various healthcare professionals and facilitates interventions for patients at high risk or in need of specific programs and services. Population Health Explorer is an easy-to-use interface for clinicians or a patient's care team to access their patient's latest encounters and each patient's 6-month encounter history. This tool is seamlessly integrated into the HIE portal as a separate widget. So some of the key features, users can view and export latest encounters of the patients on their panel. They're able to efficiently filter data available in an encounter based on your specific inquiries. And users can click into other clinical information available in the portal directly from this tool. This includes clinical information and prescription drug monitoring where available, to name a few. So with that, I'm going to hand it off to Erin so that she can show you our wonderful Population Explorer tool.
All right, thanks so much, Bethany. Thank you, everybody. I'm just going to go ahead and share my screen here. All right. All right, so our Population Explorer tool is located on our web-based portal. So once you log in, you will see our Population Explorer tool here, or we call it the widget. It'll be right on your right-hand side of the screen. The first thing you want to do is make sure you go to this gear icon to set your defaults. So you want to set your panel default and you want to download your size. It'll be defaulted as 500, but you just want to make it 5,000. So you can view up to 5,000 patients. You may hit your save changes or, default whatever else that you would like. So every time you log in, your panel will show here. Every little rectangle is a different alert or encounter for you. This is where you will see the name of your patient, their date of birth, their admission date and time, their gender, if it's inpatient, outpatient, emergency, and what facility that they were at. This holds 25 alerts at a time and will update every 20 minutes. You can also hit the little refresh button here at the bottom. If you're more of an Excel type person and you would like to download 5,000 patients worth of information, you may go over here to the download button. You want to select, yes, I am exporting PHI, accept and continue. And then you have a way to quick filter your search for Excel. So you can click on whichever filters that you would like. And if you would like to save these for next time, you can click the Save Selected Fields by default. Then you would hit the Excel button, and then it will show all these filters with up to 5,000 patients worth. If you want to go into more detail with the Excel spreadsheet with more filters, I'll show you that in a few moments when we go into the tool. So I'm just going to find my friend Anna. So this is a fake patient, so there's no real PHI that I will be sharing today. But if I want to find out why Anna went to the ED, I can click on her name, or if you want to open up the tool, you can also hit this little caret. So I'm just going to click on her name. Takes a few seconds to load. So this will open up our detailed view. You'll be able to see the list of patients over here to the left. You'll be able to see who it was last modified by. If I scroll down a little bit, you'll be able to see all the demographics for the patient. If I scroll down a little bit more, I'll be able to find some billing information, some panel information for that patient. If you scroll down a little bit more, this is where I'm going to find all the details about the event, why she was in the ED. So I can see the event date and time. I'm sorry, the admission date and time is which admission source it was. If they had a care manager involved, all that information would be listed here as well. Their death indicator, disposition, discharge date. If they were discharged to a location, maybe a skilled nursing facility, that would be listed in here. Which facility that they were at, insurance name, what the patient complained about when they first went in, their primary diagnosis code and description. If you scroll down a hair more, you'll be able to find some graphs as to how many times the patient has been in and out of the ED, along with some risk methodology components. If I scroll down a little bit more, you'll see some ICD-10 codes for the patient. And way down at the bottom, if the patient has been in and out of the ED in the last 6 months, you will see those encounters displayed here as well. So whichever data service that you click on will change the information above to that data service. Now, if you wanted to download a nice PDF version of this patient's information, you may go here to the patient export, and you would be able to print out a really nice PDF of this information. If you wanted to jump into this patient's chart, to grab their discharge summary, you don't have to go back to the home screen and type in their name and date of birth. You will be able to right click on their name and go right into clinical information, which will pop you right into that patient's chart. We have a way to filter out this list, which I will show you momentarily. But we also have a table view. So this will give you the patient's name, date of birth, the facility name, facility type, primary care, admission date, discharge date, all sorts of things in here. You can also customize this. So if I want to go here to this little arrow, you can also sort the columns by ascending or descending. But if I go to the columns list here, this is where you can add things or subtract things from your screen. So whatever you'd like to see. We also have a really nice follow-up status column. This is a good way to keep track of your outreach and your phone calls. And to change the status, you would just click on the button and you can pick which status you would like. And you might not be interested in all the reasons why your patients are in the ED. So so this will help by filtering out all your options. You can do so many different custom filters. We have admission date and time, death, data service. I'm so sorry. The death indicator, there's diagnosis codes, there's diagnosis description, discharge date and time, disposition, encounter type, facility name, there's insurance, there's PCP in here. There's so many different filters that you can choose from. For example, if I just wanted to view all my inpatients, I can go over here to encounter type. I would select either emergency, inpatient, observation, or outpatient. I'm just going to select inpatient and hit the apply button. Now my screen is going to change to all of those who are inpatient. If I want to keep narrowing down my search, I go back up to the big drop down. Say I wanted to focus on discharges for the last week. I'm going to go to discharge date and time. And you can go as far back as 6 months worth of data. But I'm just going to select the last 7 days worth and hit the apply button. Now it's only going to show me inpatient discharges from the last week. If you want to narrow it down even more, maybe focus on your high-risk patients like your diabetics. I can go over here to diagnosis code or description. I'm going to type in E11, hit the apply button. Now I'm only going to show my diabetics who have been discharged in the last week. And you can keep narrowing down your search if you wanted to search by facility name, things like that. If you wanted to save your filters for next time, you just go down here to save current filter. You can call it whatever you want and hit the save button. And those saved filters will be stored down here in this drop down. So you can choose whatever filter you would like to view and hit the load button. And now it's going to change your screen again. If you wanted to export all of your filters, you can filter everything out at first, then go to the big export button that I showed you before. And you could filter out by those filters that we set up and plus this information in here. Hit the Excel button, and now it's going to export all that data in there for you. And I believe that is it for our Population Explorer. All right, so thank you so much. And we can, and then also, I almost forgot, on our website here, Bethany wanted me to show you how you can find out where, which organizations are connected with Connie and what kind of data we are receiving for them. So if you go to our conniect.org and then for organizations and our connected organizations dashboard, this is where you will find that data. And you'll be able to see what kind of data we are receiving. This is in alphabetical order, and this will update on a weekly basis. So thank you so much, and I will hand it back over to Bethany.
Okay, so thank you so much, Erin, for reviewing our Population Explorer tool and the Connie website. Now we'd like to open it up for questions. does anybody have any questions on how to access or what is available in our Population Explorer reports? Another key feature that we should mention coming down the pike is we are integrating some quality reporting into our Population Explorer as well. So I know we're working towards having colonoscopies available for view on the Population Explorer, so you can see who out of your patients has had that. So that's one of the new reports that we're working on, but we're always working on how can we customize our tools or build tools to help all of the healthcare organizations. So if you have feedback on what would be helpful, certainly please feel free to send that on to us as well. And I don't see any questions or any hands. Also, if we have any primary care providers on today or provider organizations, we are recruiting for a primary care work group, and we'd love to get your participation, your engagement. It is very limited in amount of time that you're spending, so it's be a very helpful, but not a very helpful group, but not very, words aren't coming, time focused, if that makes sense. Okay. So I don't see any other questions. We appreciate your time and energy today. Thank you for spending some time with us. And if you do have any other questions regarding Population Explorer, feel free to reach out. If you're interested in being in our primary care provider work group, feel free to reach out as well. Thank you for the wonderful service that you provide to our communities. Thanks.